Hello, thank you for your interest in our project. My name is Amber Marsh. I'm a fourth-year medical student at Albert Einstein College of Medicine in the Bronx. Our research focuses on cognitive motor interference's role in predicting 6-month health outcomes in survivors of acute respiratory failure. So what is cognitive motor interference, or CMI? CMI is a decrease in the speed or accuracy of a motor task when it is combined with a cognitive task simultaneously, as opposed to when the motor task is done alone. CMI is more pronounced in older adults and is associated with an increased risk of falls or dementia. In this study, we quantified CMI in survivors of acute respiratory failure by using a finger tapping test along with the Serial 2 cognitive test, which involves counting backwards from a double-digit number, skipping every other number. So CMI was measured as dual task cost, which was calculated as a percentage of the difference in upper extremity mobility speed under single task conditions and upper extremity mobility speed under dual task conditions. Just to clarify, if a participant had a dual task of 45%, this means that on average, the finger tapping speed decreased 45% under dual task conditions as compared with the single task conditions. So we proposed that higher dual task costs and average dual task costs above 18% are associated with increased incidence of mortality, new severe disability defined as a decrease in ability to perform activities of daily living, and hospital readmissions within 6 months. So readmissions, death, new disability, and the combined endpoint of new disability and death within 6 months were all associated with a higher median DTC. Readmissions were not associated with a DTC greater than 18%. Death, new disability, and the combined endpoint of death and or disability at 6 months were associated with a DTC greater than 18%. The combined endpoint of new disability or death was statistically significantly associated with higher DTC and DTC greater than 18%. So ultimately, this was a small sample size feasibility study. We think these results justify larger studies focusing on CMI as a prognostic enrichment tool aimed at the early detection of adults at high risk of disability outcomes after acute respiratory failure. So I would like to thank my mentor, Dr. Aluko Hope, for his guidance and support in this presentation. Thank you so much for your interest in our project, and have a wonderful conference.